A summer's day turns deadly when a toddler is attacked by a microscopic monster.
I thought that she was gonna die. It was like death was there, like death was imminent.
A firefighter's family is torn apart by a single-celled killer that lives all around us.
I just knew my husband was fighting and fighting for his life.
And a teenager could lose her sight when a horde of hungry worms invades her eye.
She's saying, "No, I can't see, Mom." I just broke down and cried.
3 very different parasites, one shared strategy. They hide in plain sight. They are waiting to strike. They are everywhere. They are the lurkers. Parasites are organisms that survive by living and feeding off other creatures called hosts.
All parasites face the same challenge. They need to get to a host and reproduce. The most cunning parasites have a brilliant strategy to do this. They sit and wait, ready to attack at a moment's notice.
Parasites lurk everywhere, even in your own backyard, as one Oregon family is about to find out. 2009. Steve and Jenny Hastings live with their 3-year-old daughter, Camber, in remote Jefferson, Oregon.
We live in a farming community with lots of horses and a lot of farms.
It's a country setting, and we have a field and a large backyard.
The family keeps animals on their farm and even have their own well.
We are outside constantly. We have a garden, we play on our play structure, we swim in the pool, and just spend a lot of time outside.
On the surface, their life seems idyllic, but they have no idea that a deadly intruder is lurking, ready to strike. One night in the middle of summer, Jenny and Steve are sound asleep in bed when they are awoken by a strange noise.
I woke up to the sound of choking. Camber had crawled in bed with Steve and myself, and she really violently threw up just right on him.
I knew that she was not feeling good. I started getting a little bit worried.
Steve takes Camber into the bathroom. As she continued to throw up, it just started to dawn on me that this was an incredible amount of throw up for such a little girl.
Over the next 4 hours, the vomiting gets steadily worse.
She had never been sick like this before. I count down the hours. At 8 o'clock, I'm calling the doctor's office. I explained that Camber is really sick, and right away, the doctor tells me that it sounds like the 24-hour flu. Kids her age get it all the time. I've never experienced a child with stomach flu, so I didn't think anything was abnormal. They tell me to give her lots of fluids and continue to watch her.
Jenny follows doctor's orders, but after 2 days in bed, Camber's condition has not improved. And when Jenny goes to check on her, she is worried by what she finds.
I walked into the room, and the way she was laying was exactly the same way I left her. It was like she hadn't even moved.
Concerned that Camber might be seriously ill, Jenny rushes her daughter to the local emergency room. But as they wait to be seen, Camber gets even worse.
The medical assistant comes in, and she starts taking her vital signs. She tells me that Camber's heart rate was erratic. It was off the charts for what a heart rate should be for somebody that size and age, and it was due to being extremely dehydrated. The nurse tells me that she needed to get IV fluids immediately, and that was a really scary moment.
The fluids help Camber's heartbeat return to normal, and after 3 days in the hospital, the doctors decide that she is well enough to go back home. They tell Jenny that Camber just has a bad case of stomach flu, and that she will get better on her own. But Jenny's not convinced.
I'm so frustrated that they're actually bringing me the papers to discharge her. I have never seen anybody as sick as this. in my life. This is not a stomach bug. This is not the stomach flu.
But Jenny is powerless to overrule the doctor's decision. Back home, Camber's vomiting returns with a vengeance. And it's not long before she has the worst bout of diarrhea Jenny and Steve have ever seen.
This was not any type of diarrhea that I've ever seen in my entire life. It was literally like a thick, bright yellow color.
It would just go all over the bed, and we kept having to change the sheets over and over and over again.
The next morning, Jenny calls the doctor for help.
The girl that takes the message says she'll have her return the call. That happened 5 times that day. I was so frustrated, I could not believe that they were not calling me back.
As Jenny is trying to decide what to do next, Camber crawls into the kitchen.
At this point, I recognize, okay, we're about to have another episode, but this time, as she throws up, she has diarrhea. It is coming out of every part of the diaper, overflowing. She's throwing up on me across the room, and it hits the wall, and it's dripping off the wall. And she's screaming because at this point, she slips in it and falls back.
Camber is in desperate need of medical attention.
I basically picked her up, and we go to the only children's hospital that I can think of, which is Emmanuel Children's Hospital in Portland.
But Portland is a 2-hour drive from Jefferson.
I was honking the horn and weaving through traffic, and I was just praying that maybe an officer would pull me over and I could tell them so we could get there faster.
As Jenny rushes her sick daughter to the hospital, Camber's condition nosedives.
We're about halfway there, and I look up in the rearview mirror and look at Camber, and she is looking forward, but she didn't respond to my voice. That moment when I couldn't get her to respond, it was like death was there, like death was imminent. I thought that it was gonna happen. She was gonna die on that car ride.
Three-year-old Camber Hastings has been struck down by a devastating bout of vomiting and diarrhea. Desperately worried, her mother Jenny rushes her to the hospital in Portland.
I thought that it was gonna happen. She was gonna die on that car ride.
By the time they reach the hospital, Camber is barely conscious.
I'm thinking that my little girl is so sick, and nobody can tell me what's wrong with her. The hope was that I'm getting her to a children's hospital, and they're gonna be able to fix her. They're gonna know what to do.
On call is pediatric specialist Dr. Megan Keneally.
In a patient Camber size, when you have that many diarrhea stools in a 24-hour period, you get pretty dehydrated.
But dehydration isn't Camber's only problem. 24 hours later, the results are back.
About halfway through my rounds, I got a call from the lab saying that Camber Hastings' stool was positive for cryptosporidium.
When she tells me this, I immediately wanted to look it up to see what this disgusting thing could be that was invading my little girl.
Cryptosporidium parvum is a single-celled parasite that wreaks havoc when it gets into the human gut. The parasite attaches to the lining of the small intestine and prevents the host from absorbing nutrients. The body's immune system tries to rid itself of the parasite, causing severe diarrhea and vomiting. But this response can make the situation worse.
The constant diarrhea pushes nutrients out of the body, and that can cause malnutrition or even death.
Healthy adults can often recover from a cryptosporidium infection without drugs. But for the elderly, the immunocompromised, and the very young, it can be fatal. To kill the parasite, Camber is started on a course of powerful antiparasitic drugs. But Camber isn't the only one in danger. Cryptosporidium is highly infectious, and doctors are concerned that the entire family might have been exposed to the parasite. They must track down the source of the infection. They start by examining the parasite's life cycle. Cryptosporidium begins as a free-living cyst in water or soil. The cyst is eaten by a host, often a cow. Once inside the cow, the cyst multiplies in the intestines. When the cysts are passed back into the environment with the cow's feces, the life cycle repeats.
Once in the environment, the parasite's protective coating allows it to survive up to 6 months. That allows it to lie in wait until conditions are perfect for an attack.
The most common way for Cryptosporidium to infect a human is through contaminated water. Up to 95% of swimming pools, lakes, and ponds contain traces of the parasite. Dr. Keneally suspects that is how the parasite infected Camber.
I notified the public health department of their county, who would test the waters that she had been exposed to.
Just hours after the diagnosis, Jenny gets a call from the county health department.
They explained to me that they needed to backtrack and get the source of this immediately.
When health officials arrive at the Hastings home, they focus their attention on the family's well.
She tells me that she's going to need to test our water.
The Hastings don't drink from the well, but they do use it for bathing. And when the water is tested, the results are staggering.
The county was able to confirm that the water source had been infected with Cryptosporidium.
An examination of the well's structure reveals exactly how the parasite got into the water.
The casing in the well had cracked, which meant there was a groundwater contamination to the well water.
Camber most likely became infected by accidentally drinking contaminated well water while playing in her kiddie pool. After 8 days in the hospital, Camber is finally parasite-free and on the road to recovery. She's discharged, and life slowly returns to normal for the Hastings.
Although it took a little bit of time for her to get all of her weight back, she is completely normal today. She's just back out to being her normal, outgoing little self.
And Steve and Jenny install a new filtration system in their well. It uses ultraviolet light, which kills Cryptosporidium. In the United States, Cryptosporidium infects up to 8,000 people every year. In less developed parts of the world, the rate of infection is much higher.
Cryptosporidium is found in fresh water all over the world. It can live in backyards, in swimming pools, even in tap water. And when it gets in the water system, it can reach a huge number of hosts at once.
Most people who get infected with Cryptosporidium do survive. The best way to avoid contracting this parasite is to maintain good personal hygiene, especially after using the bathroom or coming into contact with soil or fresh water. Cryptosporidium isn't the only microscopic parasite that lurks around us. Others are even deadlier, as one California family is about to learn. Fall 2007, Murrieta, California. Sherry Moore is the mother of 3 teenagers, Alyssa, Brandon, and Trent. Her husband, Matt, works as a firefighter. As a family, they like to spend time together.
We like having a family-friendly atmosphere, just all the kids here and swimming and goofing off. And it's kind of crazy, but it's It's fun.
My parents really strive to make this a fun, kid-friendly house, you know.
It's early November. Sherry is at home with the kids. Matt is finishing up at the station after a day putting out a wildfire. She doesn't know it, but he's already locked in a battle with a deadly enemy.
He just came home on November 14th, and he was sick. He was a little sicker than just a regular cold.
He just looked like he had the flu, and he was just kind of out of it, and he was throwing up a lot.
But for Sherry and her family, Matt's flu-like symptoms don't come as a surprise. Matt has an autoimmune condition that occasionally causes flus and colds. The episodes always pass quickly, and Matt and Sherry are confident that this will be no different.
He just took regular cold medicine, and he stayed home and rested. He thought he was fine and that it would just pass, in a few days.
But after 5 days in bed, Matt's symptoms have not improved. In fact, they've gotten worse.
He just was complaining that his head hurt so bad. He said it didn't feel like a migraine, it felt worse than migraine. It was just scary because he never complained of headaches that bad, ever. I was afraid that he was having an aneurysm.
Concerned for her husband's health, Sherry rushes Matt to the local ER. By the time they arrive, it's clear that Matt is seriously ill. But with what?
I was thinking, please do whatever you can to find out what's wrong with him.
The doctors run a battery of tests and quickly arrive at a diagnosis.
About an hour and a half later, they figured out that he had meningitis.
Meningitis is an inflammation of the lining of the brain and spinal cord. It's usually triggered by an infection of some kind, such as a virus or a bacteria, and often clears up on its own. The doctors give Matt painkillers, and Sherry takes him home.
They figured he should be better in 5 or 6 days. We kept thinking it's just gonna pass.
But 2 weeks later, Matt is still no better. Sherry and Matt head back to the ER.
It was awful because he was feeling so sick. I was begging pretty much for a nurse or a doctor to come and look at him because he wasn't right.
This time, the doctors decide to test Matt's spinal fluid. The results are terrifying. The spinal fluid pressure is 6 times higher than normal, indicating that the lining of the brain is now severely inflamed. The only way to relieve the pressure is to drill a hole in his skull.
They realized that he was so close to death at that point. It was really scary.
The procedure works, and the pressure subsides, but the agonizing headaches remain.
I don't know what's wrong, but I know something's wrong. And I don't know medicine, but I know my husband.
If doctors can't figure out what's causing Matt's brain to swell, he could die. Firefighter Matt Moore is suffering from a mysterious brain disease that is causing the lining of his brain to swell, resulting in agonizing headaches.
I don't know what's wrong, but I know something's wrong. And I don't know medicine, but I know my husband.
In a desperate attempt to control the swelling, his doctors administer a cocktail of powerful antibiotics. But the drugs don't help, and Sherry can tell her husband is getting worse by the minute.
he wasn't getting any better, and it didn't make sense. I had no idea what it could be. I just knew in my heart it wasn't meningitis. Very frustrated because we didn't know what's wrong with him. Nobody knew what was going on.
Determined to find the root of the problem, doctors scan Matt's brain for abnormalities. The results show areas of damaged tissue or lesions inside his brain.
They described it to me as kind of like a little bit of a scarring on the brain.
In charge of Matt's case is Dr. Giant Menon. For Dr. Menon, the lesions suggest one of two possibilities.
The biggest thinking you worry about is that if there's a tumor growing in that area or an infectious process going on.
Only a biopsy will reveal the truth.
They told us that they were going to be able to perform a biopsy and hopefully get some decision on what was causing his illness.
4 weeks after being admitted to the hospital, Matt is finally wheeled into surgery. His friends and family can only wait and hope for the best.
We were all anxious for some type of diagnosis.
In the OR, Dr. Menon opens up Matt's skull and examines the lesion. But what he sees is perplexing.
Matt's brain didn't look normal at all. It didn't look like any typical infection.
The doctors report their findings to Sherry and Matt's friend, Mike.
They had told us that a large portion of the frontal lobe of Matt's brain had died, and that there was significant damage to that part of his brain.
The surgeons send a sample of the dead tissue to the lab to be analyzed. 10 days later, the lab results are finally back.
The pathologic diagnosis from the biopsy came back showing that Matt had a parasite growing in his brain.
Dr. Menon breaks the news to Matt's wife.
Dr. Menon pulled me aside and told me that they had confirmed that it was 98% fatal.
Firefighter Matt Moore is in the hospital battling for his life. His doctors have discovered that a large section of his brain has been destroyed by a deadly parasite, leaving Matt with a 2% chance of survival.
The pathologic diagnosis from the biopsy came back showing that Matt had a parasite growing in his brain. The biopsy revealed that he had Balamuthia mandrillaris.
Balamuthia mandrillaris is a microscopic amoeba with a ravenous appetite. Inside the brain, Balamuthia mandrillaris feeds on brain tissue. Nourished by the nutrient-rich tissue, it grows and reproduces by dividing over and over again. As it proliferates, immune cells and other molecules rush in to fight the infection, causing the brain to swell.
That can cause seizures, that can cause coma, that can even cause death.
But how did the amoeba get inside Matt's brain? The answer lies in the parasite's life cycle.
Balamuthia mandrillaris is a free-living amoeba. That means it doesn't need a host to survive.
Encased in a protective coat, Balamuthia travels through the air attached to dust particles. Most of the amoebas are blocked by our body's natural defenses. But in rare cases, the parasite evades the immune system and travels through the body's airways to the lungs. There, it enters the bloodstream and travels to the brain. Mike helps the doctors retrace Matt's activities in the weeks leading up to the illness.
We went backwards from when the amoeba would have taken hold and symptoms were present, and it was right at the time where Matt was involved in the wildland fires during the Santa Ana winds.
When wildfires broke out in Southern California in the fall of 2007, Matt and his colleagues fought to keep the flames at bay. For 3 weeks, strong seasonal winds kicked up huge quantities of ash, dirt, and dust. And along with it, microscopic amoeba. Doctors think that this is when Matt must have inhaled the amoeba.
We faced a lot of dangers every day we come to work, but nobody ever imagines they're gonna inhale a single-cell amoeba and have it invade their brain.
Why was Matt the only firefighter to get sick? The answer appears to lie in Matt's autoimmune condition that makes him more susceptible to infection.
He doesn't have the cells in his bones that make antibodies. So this parasite, it was able to grow and proliferate in his body.
Out of about 100 or so reported victims of this parasite, only a handful have survived. But Sherry refuses to give up hope.
I was relieved that they finally had a diagnosis, and now it was time to just cure him. I don't think that I really understood how bad it was. And I just knew my husband just was fighting and fighting all the time for his life.
Matt's doctors begin flooding his system with the powerful antibiotic cocktail the few known survivors received.
Even though we were literally bathing him in antibiotics, he just kept getting worse and worse.
4 weeks later, Matt is on life support.
He looked old. And here you have this healthy, strong man. And now he looked like he was about 80.
March 10th, 2008. 117 days since Matt first fell ill. The Moore family makes the most difficult decision they've ever faced.
As a family, we sat down, and the kids and I and his parents and his brother, and we decided that, you know, if he's gonna make it, then he needed to make it the way he wanted to make it, and that was off life support. We've been able to make it through this.
He's not gone, his legacy lives, and I hope that, you know, somewhere in the world somebody sees this, we can save a life.
Doctors stress that early diagnosis gives patients their best chance for survival. Balamuthia mandrillaris lives in the soil in temperate regions around the world. But cases of human infection are extremely rare.
Since the early 1990s, only 100 people worldwide have been diagnosed with this parasite, and most of the victims were either elderly or immunocompromised.
Scientists believe that healthy adults can make antibodies against Balamuthia. But when it gets inside a host that is incapable of fighting back, it's a killer. Balamuthia isn't the only deadly parasite that lurks in the soil, as one schoolgirl in Oregon is about to discover. 2003. 14-year-old Keisha Kendall lives with her family in rural Canby, Oregon.
We live on 18 acres of land. It's pretty far out in the country. My home life is really good. I have my mom and my dad. My older sister lives with me. She's 4 years older.
Keisha shares a special bond with her mom, Amy.
I love spending time with my mom. We do a lot of things together, anywhere from movies to just talking.
We listen to music together. We garden.
Basically anything.
She's a fabulous girl.
But the Kendalls have no idea that something is about to shatter their world. It's early May, and Keisha is just waking up.
I wake up, you know, the light's on, I get dressed, everything's bright and clear, And then when I was standing at my door, I just noticed that something was off. I had really bad depth perception.
Keisha's depth perception is so bad that she almost trips down the stairs.
They all kind of blended together. Things that were close seemed farther, or vice versa. I have never experienced it before in my life.
As the day goes on, the problem doesn't go away. But Keisha decides not to tell her mom.
I had 20/20 vision, so I just figured that it would go away and everything would be fine again. Which is probably why I didn't tell my mom at first.
The decision not to speak up is one that she will regret for the rest of her life. High school student Keisha Kendall has been having trouble with her eyesight.
I had really bad depth perception. Things that were close seemed farther, or vice versa.
But she has kept the problem to herself and decided not to visit the eye doctor.
I just figured that it would go away and everything would be fine again.
But 4 weeks after the problem began, Keisha notices that her left eye looks different.
After about a month, I did notice that when I stared at myself, it would kind of droop a little, something that wasn't noticeable if you were just talking to me.
For the first time, Keisha begins to suspect that she might have a more serious problem. 2 weeks later, the Kendalls are celebrating Keisha's sister's birthday.
We were just eating and I was talking to my mom and she noticed that my left eye wasn't following with my right eye.
I'm looking back and forth from each eye, and one of them is full of life, and the left eye is void. It's not tracking. I ask her if she's seeing out of it, and she's saying, I'm not seeing a lot out of it. No, I can't see, Mom. And that's the moment I panicked.
Amy rushes her daughter to the eye doctor.
I remember sitting in the chair and my mom telling my doctor that I couldn't see in my left eye.
He said, okay, let's take a look. And looked into her right eye and said, oh, that one looks good. And then he looked into her left eye. And he looked again into her left eye. And that's when he put his equipment down. And he said, I'm gonna go make a phone call. I'll be right back.
When the doctor returns, he tells them that he's made an emergency appointment at KC Eye Institute in Portland.
I guess I was in shock. The only thing that I knew was we're going up to see some doctors that, you know, would fix my eye and I'd be fine again.
But Amy is not so confident.
I was so worried and concerned. We couldn't, in my opinion, get there fast enough.
When they arrive, ophthalmologist Dr. Jonathan Yokin is waiting for them.
When I look at Keisha, her right eye appears to be normal, but the left eye has this unusual white pupil.
When he examines Keisha's left eye, Dr. Yokin is perplexed by what he finds.
I can see that, in fact, her retina is detached.
The retina is the part of the eye that sends visual images to the brain. It is located at the back of the eye. If it becomes detached, it can cause blindness.
I'm thinking that it's very unusual for a young child to have a sudden retinal detachment.
When he takes a closer look, he sees something even more bizarre.
And I can see multiple cyst-like structures, of which one of them actually seems to be moving a little bit on its own.
A cyst is a fluid-filled sac. It can be caused by an infection, a birth defect, or even a tumor. But Dr. Yokin has never seen a cyst that moves.
I almost dropped the lens that I was using to examine her eye at that point. I think most ophthalmologists would tell you that they've never seen anything like that in their entire career.
I didn't know how to react. Something's moving in your daughter's eye. What do you say to that?
I was pretty creeped out and kind of grossed out that there was something in me.
Something is alive inside Keisha's eye. And whatever it is, it's destroying her vision.
That's when he said she needed to have her eye operated on as soon as possible.
I didn't really know what was going on or why he would suggest that. I guess I was in shock.
I just wanted to take my baby and go home. I think that was the hardest point. I just broke down and cried.
Dr. Jonathan Yokin has just detected a mysterious cluster of cysts inside Keisha Kindle's left eye. They have already damaged her retina, and if the situation gets any worse, he may have to remove her entire eye. Keisha is immediately prepped for surgery.
I was nervous and a little afraid of, maybe they wouldn't be able to get everything out.
In the OR, Dr. Yokin makes his first incision into Keisha's left eye.
When I open up the eye, there are multiple, maybe 20 to 30 cyst-like structures encased in the vitreous.
The vitreous is a jelly-like substance in the eye that separates the lens from the retina. Keisha's is filled with cysts. Dr. Yokin begins extracting them one by one.
We've removed approximately 28 cyst-like structures that were moving a little bit on their own, and one had a worm-like structure budding from it.
As he removes each cyst, Dr. Yokin hands it off to a team of pathologists. And when they examine the cyst under a microscope, they make a terrifying discovery.
After examining the organisms that we've removed from Keisha's eye, it appears it's a tapeworm called Tinea cresciceps.
Tinea cresciceps is a rare but vicious tapeworm.
The adult tapeworm can live inside a host for years without even being detected, but as larvae, they can wreak havoc.
If the larvae get inside the human eye, they feast on the jelly-like fluid that fills the eye and chew tiny holes in the retina. The retina eventually detaches, causing blindness.
It's kind of a shock to find out that there was a parasite that was inside my eye. It was kind of unreal.
All I wanted to do was deny. This is not happening. I didn't know what we were facing.
Tinea cresciceps is extremely rare in humans. So how did it end up inside Keisha? The answer lies in the parasite's life cycle. Tinea cresciceps begins its life in the intestines of a wild canine, like a coyote. Inside the coyote, the tapeworm reproduces. Its eggs are passed with the coyote's feces and eaten by a rat. When the rat is eaten by an uninfected coyote, the life cycle is repeated. When the doctors interview Amy, she tells them that coyotes often roam across their property.
What they finally concluded is that we were probably out gardening and came in for lunch, and the parasite was on her hands.
Doctors think that if Keisha failed to wash her hands after working in soil contaminated with the tapeworm, she may have inadvertently ingested the larvae at lunch.
It got into her stomach and in turn into her bloodstream and lodged in the eye.
In the recovery room, Dr. Yokin shares the results of the surgery with Keisha and Amy.
The good news is we're able to remove all the organisms from Keisha's eye. Unfortunately, the retina is too badly damaged to repair it. She will not have any usable vision in the eye.
I think I was just shocked to hear that. And then I kind of started thinking if I would be able to cope with it and I guess have a normal life.
Keisha's battle with the parasite has forever changed her life in ways she never imagined.
I'm very adamant on if anything's wrong, I see a doctor. And I'm just more ambitious to do things, and it's actually made me a stronger person.
Tinea cresciceps is found throughout Canada and the northern United States. To avoid contracting this parasite, people living in areas populated by coyotes, wolves, and foxes should avoid handling soil that may be contaminated with animal feces, and always wash their hands thoroughly after outdoor recreation.
Tinea cresciceps has an ingenious trait that helps ensure its survival. Its eggs are covered with shells that allow them to survive for months, even outside a host.
Everywhere on the planet, parasites are on the hunt, looking for hosts to infect. Lurking all around us, until it's time to strike.
Have you ever thought that a simple itch could be a silent alarm from your body? Itching is often dismissed as a minor annoyance, but what if it's a subtle warning sign of something much more serious? In today's video, we're going to uncover the hidden meanings behind persistent itching in specific areas of your body that you should never ignore. Stay with us as we reveal the 3 critical spots where itching could signal serious health issues like diabetes, liver problems, or even inflammatory breast cancer. Understanding these signs could be the key to early detection, timely treatment, and improving your overall health and longevity. Don't miss out on this potentially life-saving information. By watching until the end, you'll learn how to listen to your body's signals and take proactive steps to protect your health. Your well-being is priceless, and this knowledge could make all the difference. Let's dive in. If you are not subscribed, I recommend subscribing and activating the notification bell so you don't miss any videos. Your support means a lot to me, and if you enjoyed this video, you can help me continue spreading the valuable lessons by liking and sharing it. If you like the topic of this video, please comment 1. If you don't, please comment 0 to let me know how I can improve and make better videos for you. Now let's begin. 1. Itchy hands and feet. Warning signs of potential health problems that you don't expect. Itchy hands and feet, something that many of us have experienced at one time or another. It might seem like nothing more than a minor inconvenience, maybe just dry skin or a simple allergic reaction. But what if that persistent itching, when it has no obvious cause and refuses to go away, is a red flag from your body, trying to get your attention? What if this sensation, as irritating as it is warning you about a much bigger problem beneath the surface, one that you've been overlooking or didn't even know to look for? It's easy to dismiss itchy hands and feet as something trivial, but this common symptom can sometimes be a sign of serious underlying health issues. For instance, one of the most unexpected and significant causes of prolonged itching in these areas is diabetes. Yes, diabetes, the condition that affects millions of people around the world, often without them knowing it. When the body's blood sugar levels are out of control, it leads to dehydration, which in turn causes the skin to become excessively dry. But it doesn't stop there. High blood sugar levels also reduce circulation to the skin, meaning that areas like the hands and feet are deprived of proper blood flow. This combination of dry skin and poor circulation creates the perfect storm for itching. Persistent, frustrating itching that doesn't go away no matter what you try. The itching, in this case, isn't just superficial. It's a result of nerve damage, a condition known as diabetic neuropathy. Imagine your nerves malfunctioning, unable to communicate properly with your brain, leading to constant itching that won't stop. You scratch and scratch, trying to find relief, but only end up damaging your skin. And here's where things get even more concerning. Once the skin is broken, it becomes vulnerable to infections, which can spiral into more serious complications for someone with diabetes. Wounds don't heal as easily, and infections can set in rapidly, potentially leading to severe consequences like ulcers or even amputations in extreme cases. All of this from what started as a simple itch. But diabetes isn't the only hidden danger behind itchy hands and feet. Another serious condition that can cause this type of itching is biliary cirrhosis, a disease of the liver that many people are unfamiliar with but should be taken very seriously. In its early stages, one of the primary symptoms is itching, especially in the palms of the hands and soles of the feet. The sensation often becomes more intense at night, making it difficult to ignore. Biliary cirrhosis is a condition where the bile ducts in the liver become damaged, causing bile to build up and ultimately leading to liver damage. It's a slow, progressive disease that can have devastating effects if left untreated, and itching is one of the earliest clues your body might give you. Can you imagine thinking you simply have dry skin only to find out that your liver is deteriorating? In addition to itching, other symptoms like extreme fatigue, dark urine, and dryness in your eyes and mouth may start to appear. These signs might seem disconnected at first, but together, they point to a serious issue that requires immediate attention. If left unchecked, biliary cirrhosis can progress to complete liver failure, a life-threatening condition. And all the while, your body had been trying to warn you through that relentless itch. It's alarming to think that something as common as itching could be linked to such significant health concerns. But that's the reality. Your body is constantly sending you signals, and it's up to you to listen. Many people go for weeks, months, or even years dealing with chronic itching, not realizing that it could be their body's way of alerting them to serious problems like diabetes or liver disease. These are not conditions you want to ignore or take lightly. The sooner you recognize the signs, the better your chances are of managing the issue before it leads to irreversible damage. If you are still watching this video and find these lessons useful, please comment one below to let me know that you are still here with me. So, what should you do if you're experiencing itchy hands and feet that just won't go away? First and foremost, don't ignore it. Pay attention to how long the itching lasts and whether it's accompanied by other symptoms, like fatigue, changes in your skin, or digestive issues. If the itching persists, especially without any clear explanation like allergies or skin conditions, it's time to see a doctor. They can run tests to determine if something more serious is at play, whether it's high blood sugar levels indicating diabetes or problems with your liver function that could point to cirrhosis or other liver diseases. The truth is, itchy hands and feet are not just a nuisance. They could be your body's cry for help, signaling that something is wrong. By paying attention to these early signs, you could catch serious health conditions before they have a chance to do more harm. Think of your body as a complex system that constantly tries to communicate with you. Every itch, every strange sensation could be a key to understanding what's going on beneath the surface. Don't wait until the symptoms worsen or until more serious problems arise. Be proactive about your health. If you're noticing these signs, take the time to investigate them further. Your life could depend on it. 2. Itchy eyes. Itchy eyes, something that most of us have experienced at some point, and we often brush it off as just a minor annoyance. Maybe you think it's just a speck of dust or dirt, or perhaps it's a mild infection like conjunctivitis. But what if I told you that persistent, unexplained itching in your eyes could be a warning sign of something far more serious? Have you ever considered that your eyes could be trying to tell you that your liver is in trouble? Many people are unaware that prolonged itchy eyes without an obvious cause could be related to liver problems, specifically cirrhosis, a condition where the liver's ability to function becomes severely impaired. The liver plays a crucial role in detoxifying our body, filtering out harmful substances, and processing bile pigments. But when the liver is overloaded or weakened, it can no longer do its job properly. The toxins and bile that should have been processed by the liver begin to build up in the bloodstream, eventually reaching the capillaries in the eyes. And when these delicate nerves in your eyes are irritated by these toxins, you start to feel that unbearable itching sensation. Now imagine your liver as a tireless worker, constantly cleansing your body, keeping you healthy, and protecting you from harmful substances. But when that worker is overworked, when the liver is struggling and unable to keep up with the demand, your body starts to show signs of distress. And one of the first places to reveal that distress is your eyes. That seemingly harmless itch is not just an eye problem, it's a cry for help from your liver, telling you that something is wrong and it's struggling to keep up. Itchy eyes, in this case, are not a simple matter of allergies or dry air. They are a warning that the liver is overwhelmed with toxins that it can't effectively filter out. This is the body's way of signaling that the liver is struggling to keep up with the detoxification process. And the itching you feel is one of the first clues that something serious is happening internally. It's almost as if your body is trying to tell you, pay attention, your liver needs help. According to traditional Chinese medicine, the liver and the eyes are closely connected. There's an ancient saying, the liver opens into the eyes, meaning that the health of your liver is directly reflected in the condition of your eyes. When your liver is weakened or under stress, it affects your eyes, leading to symptoms like dry eyes, tiredness, excessive discharge, and of course, persistent itching. It's fascinating to think that your eyes are a mirror reflecting the state of your liver. So when your eyes feel off, it might be time to start thinking about the health of your liver, not just your eyes. But this connection goes even deeper. When the liver is overloaded, it doesn't just affect the eyes, it starts a chain reaction in your entire body. Imagine toxins building up inside of you because your liver, the body's detox powerhouse, can't keep up. This buildup can lead to a host of health problems, many of which might start with seemingly minor symptoms like itchy eyes. These little signs are often the body's first attempt to get your attention before the real damage starts to set in. Many people are unaware that prolonged itchy eyes without an obvious cause could be related to liver problems, specifically cirrhosis, a condition where the liver's ability to function becomes severely impaired. The liver plays a crucial role in detoxifying our body, filtering out harmful substances and processing bile pigments. But when the liver is overloaded or weakened, it can no longer do its job properly. The toxins and bile that should have been processed by the liver begin to build up in the bloodstream, eventually reaching the capillaries in the eyes. And when these delicate nerves in your eyes are irritated by these toxins, you start to feel that unbearable itching sensation. Now imagine your liver as a tireless worker, constantly cleansing your body, keeping you healthy, and protecting you from harmful substances. But when that worker is overworked, when the liver is struggling and unable to keep up with the demand, your body starts to show signs of distress. And one of the first places to reveal that distress is your eyes. That seemingly harmless itch is not just an eye problem, it's a cry for help from your liver, telling you that something is wrong and it's struggling to keep up. Itchy eyes, in this case, are not a simple matter of allergies or dry air. They are a warning that the liver is overwhelmed with toxins that it can't effectively filter out. This is the body's way of signaling that the liver is struggling to keep up with the detoxification process. And the itching you feel is one of the first clues that something serious is happening internally. It's almost as if your body is trying to tell you, pay attention, your liver needs help. According to traditional Chinese medicine, the liver and the eyes are closely connected. There's an ancient saying, the liver opens into the eyes, meaning that the health of your liver is directly reflected in the condition of your eyes. When your liver is weakened or under stress, it affects your eyes, leading to symptoms like dry eyes, tiredness, excessive discharge, and of course, persistent itching. It's fascinating to think that your eyes are a mirror reflecting the state of your liver. So when your eyes feel off, it might be time to start thinking about the health of your liver, not just your eyes. But this connection goes even deeper. When the liver is overloaded, it doesn't just affect the eyes, it starts a chain reaction in your entire body. Imagine toxins building up inside of you because your liver, the body's detox powerhouse, can't keep up. This buildup can lead to a host of health problems, many of which might start with seemingly minor symptoms like itchy eyes. These little signs are often the body's first attempt to get your attention before the real damage starts to set in. Have you ever felt persistently itchy eyes for no clear reason and just shrugged it off, thinking it's no big deal? Now imagine if those itchy eyes are a sign that your liver is in trouble, and that your body is no longer able to process toxins as it should. This isn't just a small inconvenience, it's a serious health issue waiting to unfold. And if you ignore it for too long, the consequences could be severe. What's even more alarming is that itchy eyes could be just the beginning. If left unchecked, liver problems can escalate, leading to more significant symptoms like fatigue, dark urine, and even jaundice. Your body is giving you these early warning signs to prevent further damage, but only if you're paying attention. Don't wait until these minor annoyances turn into major health crises. If you're experiencing persistent itching, especially if it's accompanied by other symptoms like tiredness or digestive issues, it's time to take action. Don't be one of those people who dismisses itchy eyes as a trivial issue. It's easy to get caught up in the rush of daily life and overlook the subtle ways your body is communicating with you. But those persistent, itchy eyes may be telling you something much more important than you realize. This could be your liver's way of pleading for help, asking you to address the root cause before it spirals into something more serious, like cirrhosis. The liver is such an essential organ, working hard behind the scenes to keep you healthy every single day. When it starts to falter, it doesn't always scream for help in obvious ways. Instead, it sends out quieter signals, like itchy eyes, hoping you'll notice and take action. So the next time you feel that itch, think beyond the surface. Ask yourself, could this be more than just a minor irritation? Could it be a sign that something deeper is going on inside? Take care of your liver, because it takes care of you. And don't ignore the signs when they start to appear. Early detection and intervention are key when it comes to liver health. If you suspect your liver might be struggling, whether it's due to persistent itchy eyes or other symptoms, make it a priority to see a doctor. It's always better to be proactive than to wait until the problem has worsened. 3. Itchy breasts, an early warning sign about your health you can't ignore. In addition to the itching, other common signs of inflammatory breast cancer include redness of the breast, swelling, and a thickening of the skin that can resemble the texture of an orange peel. These symptoms may also be accompanied by warmth or tenderness in the breast. The affected area may become painful, but what's most alarming is how quickly these changes can happen. The cancer can progress in a matter of weeks or months, meaning that early detection and prompt treatment are essential for the best possible outcome. Why itching should never be ignored. So why is this itching such a crucial warning sign? It's because inflammatory breast cancer doesn't act like typical breast cancers. Instead of forming a lump that can be felt, it invades the lymph vessels in the skin, causing a range of visible symptoms, with itching being one of the most common early indicators. And because the disease progresses rapidly, the window for early detection is much shorter than with other types of breast cancer. This means that by the time many women seek medical attention, the cancer has already spread to nearby lymph nodes or other parts of the body, making treatment more difficult and the prognosis more severe. Imagine feeling that itch and brushing it off for weeks, maybe even months, as something insignificant. By the time you realize it's not going away, the cancer could already be spreading. This is why it's so important to be vigilant about your body's signals, especially when something like persistent itching in your breasts doesn't have an obvious cause. Don't wait until more serious symptoms appear. By then, it could be too late to catch the disease in its early stages. Accompanying symptoms to watch for. If you are experiencing persistent itching in your breasts, it's important to pay attention to any other changes that may be occurring at the same time. Inflammatory breast cancer often presents with other symptoms that should not be ignored. Redness, swelling, or a rash-like appearance on the breast are all signs that something more serious could be happening. The skin may also take on a rough texture, resembling the surface of an orange peel, and you may notice small lumps or nodes under the skin. It's easy to dismiss these symptoms as benign skin conditions, or even as side effects of changes in your diet or lifestyle. But when they occur together, and especially when they don't go away after a reasonable amount of time, they could be early signs of inflammatory breast cancer. One particularly concerning aspect is that these symptoms tend to worsen at night. If you find yourself waking up frequently to scratch your chest or feeling discomfort that prevents you from sleeping, This could be a strong indicator that something isn't right. Another symptom to be mindful of is swelling in the lymph nodes, particularly under your arms or around your collarbone. If these areas feel tender or swollen, it's essential to seek medical attention as soon as possible. Swollen lymph nodes can indicate that the cancer has spread beyond the breast tissue, which requires immediate and aggressive treatment. What to do if you notice persistent itching and other symptoms? The moment you notice persistent itching in your breasts, accompanied by any of the symptoms mentioned above, it's time to take action. Don't delay or assume the issue will resolve itself. Schedule a visit to your healthcare provider for a thorough evaluation. Early detection is key to treating inflammatory breast cancer, and the sooner you get a diagnosis, the better your chances of effective treatment. Doctors will likely perform imaging tests, such as a mammogram or an ultrasound, to get a better look at the breast tissue and determine if further testing, such as a biopsy, is needed. It may be scary to think about the possibility of cancer, but ignoring the symptoms will not make them go away. Ignoring them could give the disease more time to spread. Acting quickly can mean the difference between catching the cancer early and being able to treat it more effectively, or facing a more difficult road ahead if the cancer has already advanced. Listen to your body. It could save your life. We often overlook or dismiss the small signs that our body gives us, especially when they seem minor or easy to explain. But itchy breasts, especially when the cause is unknown and the itch persists, should never be ignored. Your body has a remarkable way of signaling when something is wrong, and it's up to you to listen. Don't let a seemingly minor symptom go unchecked when it could be your body's way of alerting you to a serious underlying condition. It's important to recognize that, especially as we age, our bodies may give us subtle hints that something isn't right. Itchy breasts could be a sign that your body needs attention. Even if you're not experiencing the severe symptoms associated with cancer, it's always worth paying close attention to any persistent changes in your body. Preventative care and vigilance, protecting your health. Beyond being aware of specific symptoms, one of the most powerful tools you have is preventative care. Regular checkups, mammograms, and self-exams are critical components in detecting breast cancer early. Don't wait for something to feel wrong before seeking medical advice. Routine screenings can catch cancer before it has a chance to show symptoms, improving your chances of a full recovery. If you are still watching this video and find these lessons useful, please comment 3 below to let me know that you are still here with me. Your health is your most precious asset, and it's something that requires constant attention and care. No matter how small a symptom may seem, if it persists and doesn't improve, it's always worth getting checked out. An itchy breast may seem minor, but it can be a signal of something much more serious. By being proactive about your health, you can catch potential problems early, get the treatment you need, and continue living a long, healthy life. As we come to the end of this important discussion, it's clear that even the smallest symptoms, like persistent itching, can sometimes be a signal from our bodies that something serious is happening beneath the surface. Your health is your most valuable asset, and paying attention to these subtle signs can make all the difference in catching dangerous diseases early on. So, what have you learned from this video? We'd love to hear from you. Share in the comments below one thing you've learned and how you plan to bring it into practice in your life. Whether it's being more vigilant about your health or seeking medical advice for unusual symptoms, your experiences and insights could help others on their health journey too. If you found this video helpful, please leave a comment, give it a thumbs up, and don't forget to like, share, and subscribe to our YouTube channel for more content that empowers you to take control of your health. Your support means the world to us. Thank you for watching, and take care of yourself. Your body is always speaking to you, so never stop listening.